but I'll have you do a roll call.
Okay. Let's see. Okay. Joycelyn,
Here.
Dr. Wilson, Dr. Pandolfi,
Here.
Noel, Rita,
Here.
Michelle, she's on mute. Ron,
Here.
Michelle. Cody, can you see if Michelle's on the call?
Yeah, I was just going to say Michelle has not joined online yet.
Okay, okay, thank you. Well, we have a quorum. We can start. Thank you, Cody. Joycelyn, are you still there?
Yes, I'm still there.
Okay.
Okay, so we've had the roll call, and who's going to have to help me with the agenda because
We need, it's the approval of the agenda is your next item. Do you want me to go ahead and do this for you, Joycelyn?
How about if I so move?
That would be lovely.
Second.
thank you.
Cody, do you
I'll
have a, okay, Michelle just joined. I just got a message from Cody.
Okay, great.
So Rita moved that we accept the agenda and Ron seconded. So then,
Okay. All those in favor?
aye.
Say aye. Aye. Any opposed? Any abstaining? Okay, the agenda has been approved. Next up would be approval of the minutes.
And the minutes are from April 13th. You should have them in front of you and they're also in board docs.
I'll give people a second to look that over and then I'll take a motion to approve the minutes.
I really can't remember,
That was a while ago.
but I hope if there's any discussion, then we have it on video.
Okay, can anybody hear me?
Yes.
Yes, we can hear you.
Okay, well, my phone keeps muting me, so, and I'm driving, so if you need me for a vote, like, give me a minute.
Okay.
Will do.
Okay, thanks.
I can totally commiserate today, yes. Okay. Anyone has a motion to approve the minutes or any adjustments to the minutes?
I'll motion.
Okay, we have,
There you
we
go.
have a motion to approve the minutes. Do we have a second?
Second.
Okay, Rita seconded.
Okay, thank you. All those in favor? You say aye?
Aye.
I suppose, I guess.
It's just been so long. That's why
I'm supposing.
Okay, any opposed? Any abstentions? Okay, the minutes have been approved. Next up would be the preliminary insurance report. I'll turn that over to staff.
Okay, and we're gonna let Jennifer do this. This is something we do every fall, just to give you an update on where we are and what we're looking at for the upcoming year as far as insurance goes.
Hi, everyone. So we're going to talk about the plan, the insurance benefits plan that renew for January 1st for the plan year for health insurance, dental insurance, vision insurance that we offer to staff. For the health insurance, just as a refresher, we do fund health insurance via a self-funded model with Blue KC called Cost Plus. Instead of paying a premium to Blue Cross, a straight premium where they keep the savings. Instead, we pay for administrative fees and we pay for stop loss coverage or reinsurance for high cost claims. And then we reimburse Blue Cross for the claims that are paid for our members. And that helps us help smooth out healthcare costs instead of just a continuous growth of monthly premium year over year. Stop loss coverage is the insurance that we have in place. If any individual member has more than $75,000 in claims in a calendar year, then the reinsurance kicks in, the stop loss coverage kicks in and starts covering the rest of the claims for that person for the calendar year at 100%. Sometimes that's called pooling charge. So there are other names for it. So that's just kind of a review of how we currently do it. This year we went out to market in order to, make sure that our health insurance, the rates that we're paying for admin fees and things like that are competitive, and to see that we are doing everything that we can to control healthcare costs for our staff. We looked at offers from self-funded and fully insured plans this year. And after we reviewed everything, we are electing to remain with Blue KC, and their cost plus program. But I do want to talk about what the offers and the things that we got, the quotes that we got from the other health insurance companies. So we got quotes from Blue KC, Humana, and UMR for a different kind of self-funded plan called an administrative services only plan, or ASO plan. This impacts cash flow because it is a weekly cash flow out versus the monthly that we pay now. And MCPL does accept greater claims risk liability. The cost projections for the UMR quote were higher than really any of the cost projections on any of the other plans. We did get quotes for fully insured plans from Blue KC, Humana, and Cigna. Always the upside of a fully insured plan is that it caps your liability at the amount of your plan premium, but the insurance company then retains any savings on plan costs if the premium that they collect is greater than your claims. Issue that we have with when we looked at fully insured and the potential for that, and I know that we've talked about the health insurance fund before, but the library has one. It's governed by it's set up by board policy, and that's where we pay for the cost for health insurance. Having that fund has helped us kind of smooth out the bouncing around of the cost of health coverage. And so when we went to fully insured, that would go away. And nobody was willing to offer us a rate guarantee or a rate cap for that second year, which always can be, they sometimes try to give you a really cheap price to get you in the door, just like with anything else. And so you always want to think about that second year, that third year, what that could look like. And so that takes away some of our independence that we have by doing the self-funded cost plus renewal. The cool part was, and we can look at that next slide, Cody. Because we went out to market, Blue KC did come back with a flat renewal. They did come back with a really good renewal first. So we would expect to see an increase to admin fees, and they came back with 2.5%. We would expect to see a good increase to stop loss coverage because it is, we do have high cost claimants. There's a lot of inflation going on, so that's impacting claims costs. But they did come in with 4.7% there originally, but they agreed to no increase to administrative fees for 2023 and no increase to the stop loss coverage premium. So the only increase in cost that we would see for 2023 is, the increased cost in claims, which we would expect to see based on all of the factors. It's helpful that, that cash flow wise that we only reimburse Blue KC once a month. So that's a little bit more beneficial than doing a weekly ASO funding. And the projected plan costs for the plan can be covered by the proposed budget and still keep the health insurance fund in the range that's dictated by board policy. Okay, so we can look at that next slide, Cody. So just as an FYI, some other things that we looked at, we did review some narrow network Blue KC offerings. So SpiraCare and Blue Select Plus. They aren't really feasible for us at this time because both of them do not have adequate hospital coverage in Eastern Jackson County. The only hospital that's covered on both of those is, well, it would be University Health Lakewood or Truman Lakewood, but there's no other hospital coverage in Eastern Jackson County on either of those plans. SpiraCare is kind of cool. The team did tour one of their SpiraCare clinics down at the Crossroads. Kind of reminds me of, in the 90s when we had HMOs and you like went to that clinic. It's a similar kind of setup, but it's a bit more holistic. And but that's where primary care would be delivered, and then they have a specialist network, outside of those clinics. However, the SpiraCare clinic in Independence isn't open yet, so the challenge is always going to be, that we have folks living, in North Platte, almost sometimes South Buchanan, all the way down to Southern Jackson County and then east. And so we have a lot of area to try to think about when we think about things like insurance networks. Okay, well, that's the end of health insurance excitement. Do you have any questions about the health insurance?
Okay, does anyone have any questions?
Jennifer, you said that at 75, if I understand correctly, at $75,000, the plan has 100% coverage for the employee. Okay, of the $75,000, is any of that covered by any assistance at all, or is that?
Now that's our deductible. So there's two separate deductibles. So there's a per person deductible. One person has 75,000 in claims, then Blue Cross picks up. We are going to pick up the first 75,000, but for the person, their deductible is 1,500. I was trying to remember what it was.
Okay.
1,500. So the 75,000 is the librari's deductible for paying claims.
I just want to clarify that no employee will be facing something.
No.
Okay.
No, and we're not looking at plan redesign for this year, but likely we'll be looking at it for the following year. It's been several years since we've had any, but we've already started talking with our benefits consultant Lockton about what some creative options would look like to try to keep plan costs low for the libraries, to still keep money in our staff's pockets so that it's not a huge impact on them, but it may mean that the plan looks a little bit different than what it does now. But we will we'll be looking at some of those options and how we can help keep those costs under control, because they go faster than regular inflation typically, and we've been able to help mitigate that with doing it in the self-funded cost plus contract. So
If I could just, not to go too far off on a tangent, but does the library offer any type of, for example, subsidized membership at health organizations or anything like that for overall?
So on my team, I have a wellness coordinator.
Okay.
I don't know that we've ever talked about that in here. Who communicates with staff and works on programs with staff, always. She has, Bonnie is her name. She's been on our team as an employee just for a couple of years, but she was previously an employee with St. Luke's, and we contract with her. We actually get the money for having a wellness coordinator directly from Blue Cross as part of their community wellness interests. We through Blue Cross, there are discounts at some fitness places. I want to say, I don't know if it's still Anytime Fitness. And then we've been talking about again, as we used to, but getting, looking at partnering with the Y. I have someone on my team that worked at the Y. So I have someone on my team that worked at the Y and another person on my team that worked at the Y Head Start. So that's an option that we talked about. But yes, we definitely want staff to stay well. Is how we would.
Sure.
Question too. Do any of these plans, myself and a lot of people that think like me, we don't go to an MD, we go to an ND, like a naturalist doctor. So do any plans help support, people like that want to do a natural approach?
The only, there's two different things. There's a discount program that is offered through Blue Cross, through Blue KC. And then we do have because this can sometimes be a way that folks access care. In that way, we do have, coverage for chiropractic care and visiting a chiropractor in lieu of, an MD or a DO for those things.
So most of these include chiropractic.
Yeah.
But,
Oh, yeah. It's part of our plan. It has been for a while.
but not like an ND, like a naturalistic.
No, I think there would be, if it was like coverage for a registered dietitian. I mean, I know that you're talking about a naturopath,
Naturopathic.
but not for a naturopath, just exclusively.
So do you find that's sort of like in most plans or just like that?
Yeah, it's just standard. I don't know that in order for us to add something like that, it would be where we were, probably contracting with an individual like clinic or group or some other separate kind of plan. Health insurance plans don't cover those things in a traditional way. Because like I said, there may be covered. I mean, there may be discounts available through that network, because I know that network has acupuncturists on it. It has, different kinds of providers on it that aren't traditional providers. But that would probably, if we were going to look at something like that, that's what we would have to see if there was some other way to get to it, because it wouldn't be through a traditional insurance.
I'm just curious. And maybe you don't have a lot of demands, but I guess if you ever did have a lot of demand,
Absolutely.
then I guess you could think of something else.
Creativity is the name of the game when you're talking about trying to keep people healthy and in as efficient way as possible.
I have a question. And this may not pertain, but do you have people that are on Medicare?
Yeah, we don't have a plan that makes people come off of our plan and go on Medicare. So as long as they remain an active employee, this is their primary insurance, and Medicare remains as their secondary. And then of course, then they can sign up. So they can delay signing up for B&D because without having to pay any premium because of having coverage, through us. It typically will get someone on Medicare. This coverage plus Medicare will get you real far, if not all the way there for most things. So yeah, but we don't have any kind of shift of plan or anything like that when someone turns 65 and becomes eligible. We did sign up for, we are changing our prescription drug plan just a little bit. The new plan is a premium formulary cost savings plan that will reduce costs about $9.50 per member per month, which sounds like not a lot, but it's about it ends up being about $40,000 a year just in a rebate. But it also will help control the cost of the drugs themselves. There will be some drugs, it looks like somewhere around 30 people will have to switch to a different medication, but we did a deep dive on that data, and those folks have plenty of other, options for the same, some of it is the same medication, just a different, company that makes it. So it is, in order to long-term think about costs, it was, and when we, like I said, we hadn't pulled that data because we wanted to know what the impact on staff would be and how many staff would be impacted. So because the impact has come down because they've gotten more drug discounts, we were able to add that as a cost savings plan for 2023. Blue Casey also started last year a program called Smart Shopper. So they have a database of providers and what they charge for like particular procedures. So, like a colonoscopy or something like that. You can go and look, and there'll be providers there. They'll say how much they charge for that. And there'll be some that are preferred. And if you schedule through that program, then our member, the Blue Cross member actually gets like cash back rewards for choosing a lower cost covered provider. So it's another way to enlist employees in helping us control healthcare costs. Okay, dental insurance. We did also market dental and vision insurance for 2023 because our contract expired with Cigna. We got quotes from Cigna, Humana, Ameritas, the Standard, and Blue KC. It's always a good idea when your dental and vision contracts in to do a market, because you can really keep that cost of dental and vision down through that process. Cigna, who is our current carrier, they came back with an increase and only a 1-year rate guarantee. So just for 2023, all the other companies offered at least a 2-year rate guarantee with a decrease, except for Humana. They came back with a 2% increase, but with a 2-year rate guarantee. What we found was interesting is when we got we get these reports with lots of data about how employees use our plans. And Cigna has had some shift in their network. So we had some feedback from staff that said, hey, I got this letter from my dentist that said they're not in the Cigna network anymore, or this particular Cigna network anymore. And then we got this reporting and it said that MCPLs now at this point are only using Cigna in-network providers 65% of the time. That's really super low. And that was kind of surprising to us. That's as low as it's probably as it's ever been. We did elect to move to Blue KC for dental insurance for 1/1/23. It's going to save us about $7,000 over the current cost, so $7,200. They gave us a 3-year rate guarantee. And if our staff stay with their same providers, nobody changes dentists, that 65% number jumps up to 93.6%. So we'll have cost savings there because more of the dentists that our staff use will be in network. Vision insurance, we market it. Dental and vision is usually bundled together. So we got quotes from Cigna, Humana, Ameritas, the Standard, Blue KC. We also got a quote from VSP, but they're not a super viable option, even if they were less expensive, because then we would have to unbundle all of these. All of these companies want you to bundle your dental and vision together in order to give you better rates on both. Cigna quoted us an increase there too, with just a 1-year rate guarantee, and everyone else offered a 2-year rate guarantee. Everyone quoted a rate increase. Our loss ratio, so the amount of dollars they paid out versus how much premium we paid in, has been greater than 100% for the last 2 years. So we knew that we would see a rate increase, but with the Blue KC's rate increase wasn't as high, and they are giving us the 2-year rate guarantee. So we'll spend about $900 more a year for the coverage for 2023 with that, but we'll have that 2-year rate guarantee. And because we'd be bundling dental and vision together to save, ends up saving $6,300 by bundling them together with a longer rate guarantee. So, any questions about dental or vision? I know it's exciting. All right, that's all I got, I think. Thanks for that thing.
Jennifer, and I noticed you had the premium rates covered here, but are the benefits to the employees roughly the same with different plans?
We had them build up the plan just, when we went out to market, just build it identical to what it is now.
So okay.
Yeah, so we kept it the same.
Good.
So if there's no more questions, can we move on to the next item on our agenda?
Yep, what's next?
Do we want to do what? You cut out, sorry.
Sorry, it says there's no more questions. I suppose we can move on to the conduct policy.
Is this a non-voting thing, the insurance?
Yeah, that was just informational.
Okay.
The conduct policy, we have, now that we have newer spaces that are special event spaces at Midwest Genealogy, the Woodneath Auditorium, and soon to be Culinary Center, people are renting these out and they want to do banquets. You know, for example, the Jackson County Historical Society wants to do their annual dinner in our spaces. That's an after hours event. You generally want to serve wine at their event. Our conduct policy prohibits alcohol consumption and solicitation. I mean, and I'm not sure how it would, sometimes authors sell books and things like that. So that's where the solicitation would come in. Right now, they're not allowed to do that by policy. We would like to be able to allow them to do that so that we can get more use out of those spaces, but it would only happen with room agreements in place and approved by staff before the event. So it wouldn't be everybody. It wouldn't be just because, oh, hey, I want to come do this. It would have to be a very specific purpose. All of our catering requirements require them to be licensed and all of that. And in order to serve alcohol, the caterer and or bartender has to be licensed as well. So they can't just, this is the president of the organization isn't going to go in there and be serving wine. They have to be licensed and with the ability to do that. There's also other guidelines. If they have that, the room rental agreement says that there will be security on site and the organization is required to pay for that additional security just as a precaution. It explicitly says no one underage is allowed, and all of those things that you would expect to be in the agreement. So because this is outside of the conduct policy, we would like approval to go to the full board for approval to be able to allow these on special occasions at only those 3 locations. The culinary center that could be a library program too, if we were done in the evening, because how to do home brewery or wine and cheese pairings or, something along those lines that people might want to do. I'm not saying that's what we're going to do, but I don't want to eliminate staff programming at that site. That would not be typically something we would do at the other 2 locations, but I could see, something involving alcohol, at the culinary center. But so the exception to the conduct policy would be only if it is approved by staff under very specific agreements at 3 locations, not all of them.
So people are rent out the library for a keg party.
No, you cannot come to the library for a keg party. Absolutely not. We would
Susan, I can also, just a minute, Susan, I can also see at the culinary center, many recipes called for various types of wine. So it would only make sense to allow for the chefs or anyone doing the presentations to be able to use their recipes as is.
My holiday baking includes alcohol, so in some recipes. So I totally understand that.
And then Michelle, I think, had a comment.
Yeah, my only comment is on, we need to have a policy or have Dustin on the sizes. Cause like at MGC or Woodney, the gatherings could get large when you say you have an after hours event and there's wine being served or, for whatever reason, there needs to be like a certain number of people or above, like we're going to require 2 officers versus 1 kind of a thing.
Yeah.
And that's an officer safety thing that needs to be in there.
Yeah.
Yes, I totally agree, Michelle. I think on that side, that's a procedures policy. I think what she's looking for is an
I get it.
overarching board policy. But yeah,
I get it. I just want to make sure I said something before it was out and done.
Absolutely.
Yeah, and it just says hiring of security, and it doesn't say 1 person, 2 people, 3 people, 4 people. We would measure that depending upon, and once you get tables and stuff set up, that also limits how many people can actually be in the space. But
I understand, but Dustin needs to set. I mean, that's stuff just happens.
Yeah.
So anyway,
and he's been in on these conversations, so this isn't something new to him. He's aware that it may be 2 of them.
I'm not saying it is. I've just helped a few places with this, and at a certain point, it
Yeah.
just is something that when
Yeah.
when it reaches a certain number and there's alcohol being, it just becomes a safety issue for the
Yeah.
officer. That's all I'm saying.
Yep, we got it. Thank you.
Thank you, Michelle. We'll take that as a recommendation that
Yeah.
staff develop that further as a procedures piece of it. Any other questions, comments?
I think I just wanted to even hear more, let Michelle elaborate even more, because I don't know, are we setting ourselves up for, I don't know. what it
No,
is.
we're not setting ourselves up for anything. It's just, I'd rather have too much than not enough. And, you always get that, there's always, all it takes is one, you know, and so
Yeah.
it's just be over prepared, is it? And we're not having, wedding receptions here.
Oh,
But,
no, we're not. That's not even
I
allowed.
mean, I know, but I mean, I'm just saying, it just because, it's just something just to have, and just to have in place, you get 200 people and in some place and we're serving alcohol and, one person does something, it's a lot to ask of one person. So that's all I'm saying. We're not setting ourselves up for anything.
No.
It's just, it just is what it is. That's all I'm
And what
saying. I
kind
think
of
we're fine.
events? I just wonder what kind of events are these?
Well, it could be somebody having a banquet because we can we can cater at these locations as well, two of the locations, not so much the culinary center. But, because Jackson County Historical Society has asked to use our space. Truman Heartland has done, they did a luncheon that didn't have food. I mean, they didn't have alcohol at it. But if it's an evening thing, and it would be very specific on what they're doing, how many people, and it's not going to be just, I'm not going to go in there and just say I'm having a party in the auditorium and I want to serve alcohol. That's not going to happen. We don't allow personal parties. So there's no bachelorette, there's no bachelor parties, there's no wedding receptions, there's no baby showers, there's no 21st birthday parties or whatever. Not that a 21-year-old is going to want to have their party at the library anyway, but
I don't know.
it's going to be an exception, not the rule.
Are we generally, this is my question. I'm just, are we generally talking about like charitable organizations, 501c3 organizations?
For the most part, that's
a lot of it.
That's a lot of it.
Yeah, pre-COVID, remember, Mr. Dickens, who was here at the Genealogy Center and a presentation, there was a meal in connection with that. And they're all library. Foundation is always library.
Yeah, it might be a library lovers event, and
Sure.
that would be, that's very much controlled by us on who attends and who doesn't attend. There may be wine or there might not be. But again, we would hire licensed bartenders and all of that. Staff is not going to be serving anything.
So Ron and Rita, how do you guys feel about it?
What's that?
What do you guys
I guess my thought would be that first of all, I don't envision much of a risk because, people that come to the library are not biker types. So I don't see that.
don't say that? There's some good bikers out there.
Yeah,
Not the ones that come to mind right away.
Not the bad ones.
The activities I've been, where there've been gatherings that maybe alcohol would have been fitting, to me were, I see this in a complimentary way, low key, not festive and sort of thing. It's just more of if alcohol were to be available, I couldn't even imagine a lot of people actually accessing it, but. One thing too, I think when you have the standard agreement, I think we want to ensure that the staff is given enough discretion that in their prudential judgment, they can kind of control all the variables, like Michelle said about the number of cops, police officers.
Yeah.
Just that sort of thing. And maybe control, like give tickets or something like that per drink. It's some kind of and hold harmless indemnification, all that stuff.
Oh, that's all in the agreement anyway.
Good,
I mean,
good.
and the agreement's already been through the attorney.
Good.
So that's covered.
Yeah.
Rita, you have any thoughts?
Will we get to see the agreement and talk about it before we vote on it?
This is the conduct policy.
The conduct policy?
Yeah, it's kind of,
Yeah, well, the conduct policy's online. I mean, it's the standard. This would just be a paragraph in the agreement that's saying you can't do this without explicit permission. And then if you do, you have to have officers.
Well, what has been to the what has been through legal counsel?
The room rental agreement.
All of that, okay.
Yeah.
Does that depend on number of bodies? So if 45 people come, the room rental goes higher or not? Rather than 10?
Setup will, yeah. Well, and the event spaces have actual charges and it's by hour and by, like there's 4 spaces at Midwest Genealogy. Do you want the entire 4 spaces or do you want one room?
I see.
So that's based on size. It's based on the number of hours that you're in there, that kind of thing.
And size of room, not number of people.
Well, the size of your room is going to dictate the number of people.
To an
Yes.
extent. Yeah.
Yes, it will.
Do you
yeah,
have,
one way to think about this is that the library already does some of these events that does have alcohol. It's just at other venues. This is a way to allow the library to have those type of programming and events here on site. It's another way to look at it.
Did you have another question?
yeah, I do, but I don't know whether it doesn't fit into the conduct policy, but it does fit into the room rentals. That is, if a group of children are exploring one activity, can they come in or do they also have to pay the
No.
rental?
The room rentals are by groups. They're not going to be kids. It isn't going to be somebody just walking in random. These are going to be, if you're renting the room, then your group gets to use the room. And if there's kids present, they're not going to be alcohol. You've got to be of age to be in that
I'm
program.
not talking about alcohol, conduct with alcohol. I'm talking about just the room. So if a 4-H group wanted to come in and explore, through books or through activities,
They can rent the room too.
they would have to rent it.
Yes.
I thought there's some community rooms that are, you don't. that are
Depends
just-
on how big the size of the room is. There are some rooms that are free. Yes.
Yeah, so it's-
Yes.
Okay.
Yeah. Yes.
In the sake of time and the fact that both Michelle and I are driving and using a cellular data,
We're
can
done.
we get back to the topic at hand? Those are good questions to explore maybe another time, but right now we're talking about the conduct policy. Thank you. Any other questions specific to that? Otherwise, I'm ready to move on to taking a motion to approve this to take to the full board for discussion.
So moved.
Is there a second?
Second.
Ron just seconded.
Okay, thank you. There's a motion and a second on the floor. If we can, all those in favor, please say aye. Aye.
I think, yeah.
Any opposed? Any abstain?
Staying.
Rita's abstaining.
Okay,
'Cause
All right.
you can- She can't see your hand, so
yeah, I can't see.
I heard.
you got it.
I've got it.
And, okay, thank you, everyone. Can we move on to the next item, which is budget amendments?
Yep. As directed, at the full board, staff went through and looked at the budget in order to cut $1.31 million out of the budget. The net reduction in personnel will be $450,000. I'm going to have Jennifer tell you where that came from. We're taking almost 470 out of materials and another 358 out of the general operating. So,
I've got a question about this before you start explaining. Is this an okay time?
yes.
Okay, because what would help is if, for me, if we could see, because you're talking about reducing the proposed budget, right? But in here, maybe this is it, but what I was trying to look at are the numbers from the previous year. Is that this column here?
That actually is this time, because
Okay.
I think that someone had said that we put the previous budget. And this time, that column over there, instead of previous budget, it's previous spending.
Okay, so what I'm trying to get a look at is just comparing like last year and then, so obviously the projected next year is higher.
Oh,
It's,
you're looking at a different sheet than I am. Okay.
I'm looking at the 22-23 proposed personnel budget, not this one. So I guess my question, when you go through this, I'm trying to, wrap my brain around it, is that the budget, the budget is going up from last year. Is that correct?
Yes.
It's just not going up as much now.
Yes,
Is that the thing? Okay,
Yes.
see, that's because that I feel like it's how everything is written. It's like the budget's being cut. And so I think in reality, the budget is not being cut. It's just not being increased as much. Is that correct?
Not exactly, because we have a default budget. That's what we've been working off of.
No, I don't mean budget. I mean, the numbers from last year, say the part-time staff or the unemployed, are all of these categories, are they not going up from last year?
Yes, they are.
Okay.
Yeah, and that's what you'll see. The parts that are highlighted in red, all the way out to the left, are the actual like line items and accounts that are in the budget.
Okay.
And then you'll see the
Well-
first column is the proposed for 22-23. The second column is the spend, not the budget, but the spend for 21-22, and then the percent of
Yes.
increase. And yes, it has gone up. The budget for this year is higher than the spend for last year. the
Okay.
one we spent last year.
That's what I feel like is not if someone out there, now not many people from the public listen to these things, but if someone is out there, I think that needs to be communicating. We're not cutting things from last year. We are increasing things, but not by as much as was previously proposed. So anyway, I just wanted to say that in case somebody is watching, because we have news people contacting me and other people saying, you're cutting these things. And so that's not made clear. So I'm trying to make that crystal clear, is that the budget is going up from last year just by not as much. But anyway, I just want to thank you.
Yeah, I mean, if we can let staff go through it, I think that point will be clearer or clarified. And I think that, I think from many of the public that I've spoken to, they understand that the budget was set higher than last year to meet the current level of service, and what they were expecting is being cut. I don't think that they're thinking it's going to be less than last year.
Okay, well,
But I understand, let me finish. I understand.
I'm just saying what is being communicated to me, especially.
And I'm
via
saying,
the
yeah, if
press.
I may finish,
Okay.
I'm saying what has been communicated to me is something completely different.
Okay, well, that's fine. So I just wanted to make that clear when we're online. Thank you.
Okay. Jennifer, do you want to walk through this?
Sure. This version of the personnel budget has been updated to, to cut from the proposed budget from earlier this year. This isn't just a clear cut to one line item, because we do have an additional 6 months of data and a quarter of this year under our belt. So we have more information in order to write this budget. Instead of the original budget had us adding 3 benefits eligible FTEs, we've elected to decrease by 1. We'll be shifting some positions around from facilities, tech services, and youth services, some branches, in order to add the staff member in the culinary center, meet some increasing needs in IT, and some increase to the security departments. We are still working, my team is still working on building the job descriptions from scratch. Something we haven't done, since 2011, and the compensation study goes along with that. This budget does still include money for partial or incremental implementation of the results of that compensation study. This includes the implementation of a $15 an hour minimum hourly wage for frontline customer service employees, delivery drivers, and staff custodians. On the bigger cut from budget was on the part-time staff budget, and this was an interesting deep dive that we took here and separated some stuff out and got to look at it a little bit closer. So it is an increase of the spend over last year, but it is a cut over the budget that we proposed in the summer. It is being increased because there is that hourly wage increase for to $12.25 for our bookshelvers, our library pages, and circulation aids. And then the implementation of the $15 minimum hourly wage for the frontline customer service employees.
So what was that before? Was 12?
It was for like the graded staff. So we have pages, and then we have our graded staff. It was $13.71 previously. So
all those, that's the lowest we were paying anybody is 13.
Yeah, on the graded staff, we still pay pages $12.25, and that particular job has no other role except for putting away the books and shelf reading. So they don't provide computer assistance, technology assistance, checking out books.
So the pages, will they now be making
They make
15?
they'll make $12.25.
They're still staying at that.
Correct. So they're going from, I think they were $11.50 before.
Okay, so
So
they're
they're going
just
to
going up
$12.25.
a little bit. So
Yeah.
it's the $13 an hour people that are now
Correct.
going to 15.
Correct. And then we have been shifting to having fewer dedicated pages, particularly at smaller locations, so that we do have more desk associates, customer service associates that are more versatile. They can also help put away books, but they can also help with tech help, checking out books, finding things, that sort of thing. So we have been doing that. We really started doing that a lot during COVID. And we are returning to a full schedule of programming. After a 2-year interruption is what it feels like. We're just now really getting this season just ramped back up to having the full schedule of programming. This just wants me to draw a picture on my screen. The other line items that you see there, like Social Security is an automatic calculation. We did reduce the budget for unemployment. We are self-insured for unemployment, so we don't pay unemployment insurance. We only pay claims for folks that file unemployment claims. We rarely have any. We're not a place that lays people off, in mass numbers or does a lot of involuntary terminations, but we do have, a handful. But historically, that amount will be enough. So. The retirement funding is a calculation. Logger sets that rate. And so it's 17.2%. It actually is going to go down for 23-24, which is good news. Since we took a bigger cut from the part-time budget, we are adding a little bit more to the health insurance fund, just so that we can make sure that we're staying somewhere in the middle of the minimum and maximum on the health insurance in terms of what we project. The ancillary insurance is the long-term disability and the life insurance, and that's a calculation. The premium is based on benefits eligible staff salaries. And then we do have the employee assistance program that we provide for staff. And we do have the HR admin budget, which covers background checks and mandatory compliance training and our employee recognition program and things like that. So to your point, Jenny, it is an 8.81% increase over last year's spend. So that's not all. I mean, that's when we write the budget in March and April. We have that money, that that detail. So we're able to really see it, writing it, since that year is completely over. So, but yes, that is
Right. It's good.
what we got. Any questions?
Yes.
Why are some of your numbers in red? They are not.
Those are the black kind of builds the line. The red lines are the actual account that is budgeted. So like you see the active benefits, eligible salaries, the authorized, the reduction for turnover, all of that builds that red line. And that's the red line that goes into the budget. So that 5010 is benefits eligible staff. So that's why I just kind of highlighted, because those are the lines that will show up in the actual budget document.
I know what the total one.
That's how I put it.
Yeah, so that you would follow the line is
Yeah.
good explanation.
We appreciate you expanding it,
Yeah, we are all in these meetings and we hear what you're saying and what information that you want to see, and we want to provide what you want to see so that we are so that everybody understands what we're doing, and we understand fully what it is that the board wants us to do. So
well, I can understand.
good, thank you. That makes me happy.
Thank you, Jennifer.
Yeah.
Any other questions on this piece? Okay, just a comment before we move on. Yes, this budget is a little higher than last year, but so are our staffing needs and our programming needs and everything else that was promised to the taxpayers. So while it is up, it is not up to the level that we had anticipated. You may go on, Jennifer.
We didn't hear that, Joycelyn.
Oh, sorry. I was saying that, yes, it is up from last year. However, we had buildings being completed. We have some buildings that haven't opened. We have staffing. We have positions that still remain unfunded. So while it is up, it is not going to be up to the level we had anticipated. And I just wanted to make that point before we moved on.
Well, think that's nice opinion, Joycelyn.
Next.
It's visitors' comments. Did you get anything?
No, not for this meeting in particular.
No visitors' comments?
Nope.
I believe it's other business. Any other business?
So we don't have to vote on this.
No, we don't have to vote on it. Staff was charged with making the cuts and looking at where those could be made. So they have done that, and it will be presented again to the board. Any other business? Okay. Next, is that anything after other business?
Just the
I'll take a
adjournment.
motion to
Get to be
adjourn.
done.
Thank you, everyone.
So moved.
Yes,
Second.
I'll take a
Maureen
motion and a
and Rita took that.
okay. All those in favor, say aye.
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 No one's opposed.
That's always the
Right,
fast